Health disparities is a huge problem. It's been in existence for over 100 years. What these communities have been able to demonstrate is that when you give them the capacity and the resources, they can in fact eliminate disparities. When you go out into the local communities and you see the community members, many of whom 5-6 years ago, health may not have been on their radar screen, who are now talking about health promotion and disease prevention. It's because of all of that that we're seeing the successes we're seeing today.
Here in Oklahoma, American Indians are 3 times more likely to die from diabetes. They're also more likely to die from cardiovascular disease and cancer. And all of these are obesity-related diseases. What REACH 2010 is trying to do in Oklahoma is reduce obesity in American Indian communities. And we're trying to do that through increasing physical activity. And the ultimate goal of REACH 2010 is to close the gap in diabetes and cardiovascular deaths.
Before REACH came into this community, before the tribe became a REACH partner, there wasn't anything in this community that was available for anybody to participate in. I mean, there was no fitness programs, there was no fitness centers, there was really not much.
Experiential learning, it's a process of learning by doing. They're being physically active while they're playing a game that teaches them about nutrition. In the 5-a-day game, they have a hoop on one end and they have 2 hoops by their teammates. They have index cards that have fruits, vegetables, and other foods. They have to go down and pick up a card, bring it back, and that's when they decide if it's a fruit or a vegetable. If it's a fruit or vegetable, they put it in the 5-a-day hoop. And if not, then they have to put it on the stop sign because it's not one of the fruits or vegetables that they need each day. As soon as they put a card down, the next person can go to pick up another card. The game ends is when the first team to get 5-a-day.
Girls got 5 again!
But we usually go through this game 2-3 times because kids just really like to play.
We work with all different ages. We work with handicapped people, trying to get them to be more active and find fun ways for them to be active. So we'll warm up with yoga moves, and then we'll move on and raise the heart rate, doing exercises where they lift their hands above their hearts and lifting their knees and lifting their legs. This helps them to get their heart rates up and also work that heart muscle, and helps with their breathing. You know, some of our elders have breathing problems, so the breathing that we do in the beginning and at the end, the deep breathing helps to expand the lungs and helps them to breathe easier.
A lot of our participants in this community, unfortunately, don't have cars, don't have transportation, and so their main means of transportation is walking. And if they live within the vicinity of downtown, then they can walk to us. And so we were real pleased to be downtown because people would come, and kids after school will ride their bikes or ride their skateboards to the facility and be able to come in and participate in some of the activities.
Ropes and REACH, we've formed a partnership with the Tulsa Public Schools that has just been a great benefit to both organizations. And we bring kids from all over the metropolitan area to the ropes course.
There you go, Kevin. You're doing great, buddy.
The ropes course involves many different kinds of activities, from low elements on the ground to problem-solving activities to the high elements.
Good job!
And the kids learn all about diabetes, prevention, about nutrition, about fitness, and how those things roll into helping them grow up strong and healthy, knowledgeable to make good choices. And the way it builds their self-confidence and their self-esteem is phenomenal.
If you think something's going to be scary, you'll never know until you tried it.
As a dad, you know, I look at my daughter and I want her to know there is a better way of life for her. To just be physically active, just eat right, and she'll be happier. I know she will.
My vision, I guess, would be that these families partner together and become more active as a family.
Our tribal council recently passed a resolution that will allocate 7% of our gaming allocation plan strictly for programs that have sports, physical activity, and recreation involved in it. And I think this is because they see what REACH has done in the communities.
It was always my dream as a young man to work for my tribe, to work with people, to laugh with people, and at the same time be able to help our people just live better lifestyles.
We're getting our communities active, we're getting them out, we're getting our families together, and we're educating them on the importance of being physically active and eating healthier than what they've been.
REACH has provided me this opportunity to experience it firsthand, that a success for us is that state government, federal government, and tribal government can work together because we share a common goal and a mission, and that is to improve the health of all Indian people in the state of Oklahoma.
Bronx Health REACH is a large coalition of people involved in the community who have a vested interest in eliminating health disparity. All are committed to doing whatever it takes to making sure that the health care and the quality of health and the quality of life in this community improves.
At the Mount Hope Family Practice Center here in the Bronx, we serve a large number of Latino families. We have about 85% of our population is Latino. They come from different backgrounds, even though the common thread is the Spanish language.
It's not easy because we have to get adjusted to a completely new cultural environment. Who don't have the language to communicate, don't know the system here is quite different from our system in our countries. They are disoriented. They need time to be adjusted.
We as clinicians need to get the community involved. People don't live in an isolated environment. They don't live in a bubble. They live in a community.
Each of the churches in our community has, the pastor has given to us, Bronx Health REACH, a coordinator. That coordinator is responsible for pulling together all the health activities in their congregation.
I do know that a lot of our congregants has diabetic. They have taken for granted. It's something they live with. So the program has brought awareness to them as the importance of nutrition and exercise and having the proper treatment. And we also teaching about prevention.
Health educators go to the restaurants in the neighborhood, the Latino restaurants, and they have even brought a chef to teach the people in the Latino restaurants the chefs at the Latino restaurant, how to prepare things that are low in fat, low in grease, and yet culturally satisfying. And that has been a very successful program. And then we take those restaurants and we promote them to our patients.
Eagles Restaurant decided to participate in this program because we found it interesting. And that way we can promote the healthy food and educate the people how to eat, because we are part of the community and we belong to the community. They are good for communities because we depend on them. The best way to pay them back is to educate them how to eat healthy.
The bodega owners or the little Colmado or grocery stores owners have been visited by the REACH program as well, by our health educators, and they are encouraged to store fresh fruit, oatmeal, cereals that are high in fiber.
They came to me and asked me if you're willing to help the community with healthy stuff. like through 100% natural stuff. And I was agree, do whatever they can to help. I do it because I care about the community, I care about the kids.
It is bringing into the community the nutrition and the services that they could not bring by themselves. So we are in a certain position of power to be able to affect what happens in the community, and by doing that, we affect what happens to our patients.
Really realizing the gains and what you've done is to replicate the programs. And one of the programs that comes to mind is our after-school program, the nutrition program that we ran at an after-school. Clearly, we've seen where it has been a significant success.
We're gonna sing a song for you today. It's called the Vitamin C Song. 1, 2, 3. You can get it from an orange. You can get it from a grapefruit. You can get it from a melon or a honeydew. There is plenty in a strawberry, cranberry, blackberry, blueberry, pink cherry, raspberry, and peach. There is plenty of vitamin C in each. Some of the benefits that I've noticed since working at the Mark After School program, the students started requesting more healthy and nutritious foods, not only from our program, but also from their families.
We cannot hide from the fact that our healthcare system has some real pieces existing in it that contribute to disparity.
Latinos are 3 times as likely to be uninsured. African Americans are twice as likely to be uninsured as whites.
We can do all the community education we want, and that will translate into people being empowered and advocating for themselves. But when they hit that brick wall of a healthcare system that has some real problems in it, we need to figure out that those problems need to be fixed.
In some cases, physician leadership has really made a difference, where physicians have come in and said, we're not going to practice medicine this way. We're going to integrate the care of everybody into one setting, and we're going to make this work. We're really going to help to end health disparities in our area.
We need to take part in our health. We need to be responsible for our health. And this is one of the teaching that we bring from the Bronx REACH U.S congregation.
They are willing to reach out. They're willing to go where people are and help people understand how they can become involved. That's the reason I'm here today, is because Bronx Health Reach just won't leave me alone.
This is a coalition that has made it clear that they are in this for the long haul, that health disparity is going to be eliminated on their watch.
Feel the pulse and the soul, the New York.
Yeah, the Vietnamese community here is quite large, and in this county there are about 105,000 Vietnamese. And the city of San Jose hosts the majority of Vietnamese population in here is about 85,000. In the city level, San Jose hosts the most crowded Vietnamese population in the world outside of Vietnam.
The Vietnamese REACH Coalition was created in 1999 specifically to address one main health issue, the problem of cervical cancer in Vietnamese American women. They have a rate of cervical cancer that's 5 times that of white women, and they don't get screening through the Pap test, which is a very easy way to prevent cervical cancer.
Community Action Plan is a document that from the beginning we have involved community members to understand what the problem is, and in this case, it's Vietnamese American women are more likely, 5 times more likely than the general population to get cervical cancer. And one way to address that is to increase Pap smear screening among the Vietnamese American population.
A red rose is a symbol, even in Vietnam, for womanhood, motherhood. So that's the red rose, and the red rose has a gold leaf on it, and the gold leaf has the message, Sức khỏe là vàng, thứ Pap hàng năm, which is health is gold, get a Pap test annually. So when they get the rose, they also get the message.
Vietnamese women in general tend to take on the stance of forget yourself, focus on others in your family first. Even when you have time, you don't focus on yourself. You find something else of somebody else to help and support. So for a project to focus mainly on them and their health, it was different, and I think that was probably a challenge.
The coalition understood that there were no free cervical cancer screening services available in Santa Clara County when we first started working with them. And they formed an advocacy group and created the petitions and the contacts to the legislators by the Vietnamese women asking to reestablish this service in Santa Clara County, resulting in now we do have free cervical cancer screening available.
When the lay health worker was not here, basically the Vietnamese American community do not have any knowledge or information that would culturally appropriate to the Vietnamese American woman relating to breast and cervical cancer.
As lay health workers, we have to have a heart for helping people, all kinds of people. We have to be ready to help in any way. You have to try to understand a person. And if you cannot help them, find someone who can help them and open up opportunities for them.
Within the program itself, we were able to train more than 1,500 women, but there's also media campaign where we outreach to the large amount of number of Vietnamese American residing in Santa Clara County. So it is a great effort. I'm sure that we outreach more than 100,000 Vietnamese American here in Santa Clara County.
Before coming to the United States, I didn't know anything about cancer. Then, with the help of women like mine, I began going to the doctor and getting treatment for my cancer. It helped me save my life.
There are many, many stories about people telling us that if it weren't for your program, I would not have gone to get that test. And if I didn't go get that test, I wouldn't have had found out that I had pre-cancer problems and get it fixed so that I don't get cancer later on. There are some sad stories where people will say, you know, if my family had known about this earlier, my sister or mother wouldn't have died of it. And so those are the inspirational story that keeps us going.
My friend is not good, so I really scared. So and then I take the X-ray again, but the doctor says clear. Oh, I'm so happy. I will to call you to let you know. I'm very happy too.
And the women themselves that we worked with were incredibly resourceful and smart, and they knew what the problems were, and they just needed to be told the information they needed to have to go and obtain proper health care.
Lay health workers are terrific because they are the people who have the heart, and they are the ones who are moms, sisters, friends, and who are the members of the communities.
I'm very happy because I can help the people.
We wanted to do something that make a difference in this community. REACH for Wellness focuses on health disparities, which is looking at some of the gaps in access to care, health education, health literacy, the economic realities of a community that's low income.
We do prevention on cardiovascular diseases in the Atlanta Empowerment Zone, and the prevention programs that we offer are free classes, around cardiovascular diseases.
Also, men and women empowerment groups to look at financial literacy, health literacy, stress management.
There's personal stress, job stress, family stress, financial stress, friends and community stress.
We got volunteers, about over 200, who monitor blood pressures.
This won't hurt at all.
Aerobics instructors who come out twice a week free of charge. That can help them live a longer and great quality of life in their community.
Welcome everybody to Sisters Action Team Women Empowerment Support Group.
Sisters Action Team is a network of women who have come together to examine their lives, to transform themselves, their families, and ultimately their community. Sisters Action Team basically believes that in order for us to truly be well, we must be physically well, spiritually well, emotionally well, and economically well.
Let her breathe, breathe, breathe through that pain, breathe through that anguish. It is an illusion. You can let it go.
We chose to focus on women because women are the hands that rock the cradle. And we felt that if we were able to come together as women and discuss the issues that impact our wellness from a holistic perspective, then we could transmit a legacy of wellness to future generations.
The main reason why I'm here, and the main reason why I think it's so important for men, especially black men, to talk about health, is so that we can live longer.
Turn the hands over, push it out.
You go to a lot of black family reunions, and there's very few elderly men there. Now, the elders are people who set the tone and the stage for the morality of the family and the community. Plus, I just want to live longer.
I got a chance to meet my great-grandparents, you know, and I know a lot of guys didn't have that opportunity. I need to be more health cautious and conscientious of what I eat and watch my weight. I would like to see my kids one day. I'd like to be that great-grandfather.
Prevention is much better than intervention.
I go out and do blood pressures, and I get asked a lot of questions about why am I feeling this way? Why do I have high blood pressure? Why am I diabetic? I learned a lot of stuff here today that I didn't know, so hopefully I'll be able to help them out.
Usually if you've been in a barbershop before, you know when they first walk in the door, it's almost like family. I might know a person and go, hey, Jimmy, and next thing we know, we're in a conversation with each other, and I'd ask them, you want to have your blood pressure done? And everybody's relaxed. And the next thing I know, the whole shop is having their blood pressure checked.
We have a lot of people up and down the street here that comes in and get a haircut. They probably hadn't even had the blood pressure in the last year or so. They're happy to be able to get it taken for free. I went out and got me a blood pressure machine myself since it got started. So it brings to your attention how important it is.
Most folks in our community go to their churches and barbershops more than they go to their primary care physician. So where do we go to meet people, to make a difference? And through our exercise programs, our wellness programs, we have done a great job in making sure that we bring the total community together.
The Reach for Wellness Nutrition Re-Education Program is a program that we teach where we go into the community with our cooking demonstrations and teach people how to take their traditional recipes and modify them for healthy living and healthy eating.
Today we're going to make a fruit smoothie. We have some strawberries and blueberries, we have bananas.
Whenever I give a food demonstration, I hope people will understand that first they have to make some changes, and those changes are gradual, and that it's not hard. If they work at it just a little at a time, take their time, because it took 10, 20, 30, 40 years or 50 years to eat like we've been used to eating, and it's not as healthy. But we can take that time and make those corrective changes that'll give us life and vitality.
4, 5, 6, 7, let's go for that.
having a program like REACH in our community, that opened the door where we can get the same quality of exercise and the same quality of information that's coming into us as if we were going to the bigger exercise facilities, and which most of us cannot afford. I think that it's important for the community to take responsibility for their own health and fitness because of our children. Our children now are being diagnosed with type 2 diabetes. We have kids who are getting different type of diseases that normally in the past you would not have seen these type of diseases unless they were in adults. And now we have to take charge so that these kids will have an opportunity to have a long life.
The greatness about REACH is that we have trained and empowered everyday people in the community, the mom and pops, the ushers, the missionaries.
What is stress? Good.
What is a stroke?
These are folks we've trained who now know how to take blood pressures.
Relax.
Who now understand what the side effects are of different medicines, who now understand about health education. These are folks who are going to sustain it long after we leave, and these are the true champions for REACH.
The next steps for REACH is for us to focus on disseminating and translating those lessons that we've learned in communities.
At the end of this initiative, the REACH initiative, you'll have had all this time where people have really thought through what are the real issues, what are the contributing factors, how do you fix it? And then you need to take all of those 7 years worth of learning in the trenches, on the ground, to then move and not lose it. Taking this brilliant idea CDC had to get a community engaged in fixing the problem and taking it for the community to continue addressing it and spreading it out as far as possible in all the communities affected.